I'm here to talk to you about mental health and the promise of AI. I mean, as we know, mental health is one of those specialty areas of health care which does not get the attention from the reimbursement agencies or from billing or from the general population because of social stigma. So there's so much promise for AI, so I'm here to talk to you, just to brainstorm some more. Just a little bit about my company first, Cohen Veterans Network. We are a behavioral health not-for-profit focused on mental health for veterans and their families, underscoring the families because they are sometimes not considered to be the immediate potential patients of mental health, which we have found that is very much the case. Steve Cohen, the philanthropist, actually started this network in 2016 with a $275 million commitment for our network. So you'll see that map right there. We are spread across the US. We have 24 clinics, and we are all about mental health for veterans and their families. So just wanted to kind of talk to you about just state of mental health in the country. And every time I reflect on these numbers or deliberately think about these, it brings a little bit of sadness for me. At the same time, it also gives me perspective and makes me happy that I'm able to, in some way, shape, or form, contribute to this very present problem in the country. So I mean, look at the stats, right? 1 in 5 adults suffers from mental health disorders. Suicide is the 4th leading cause of death for young adults. Mental health takes 20 years off of life expectancy, right? You wouldn't think that. And the problem is a lot of folks that live with mental health disorders don't even know that they are living with mental health disorders. One, there's lack of awareness. It's not well understood. It's not well documented. And there's always the social stigma, right? People don't want to really admit that there is something going on there. A problem that we see very much in our clinics, that a lot of folks that come in to our clinics, a lot of veterans and their families that come in, they have to struggle to kind of even explain their feelings to us at times. Like, what is going on? Are you really having a problem? Do you really just want someone to talk to? So again, very, very clear and present problem. The gap between those who need care and those who have access to care is substantial. So one of the many things that got worse during our pandemic, right, was access to mental health care. I mean, as it is, there used to be just in general shortages in staff, whether it was LCSWs or folks that can do social work and do talk therapy. There was a shortage as it is, but the pandemic made it worse. And right now, I mean, staff shortages, qualified staff is so hard to find, despite telehealth being very much the booming way of modality now in healthcare. High cost, mental health care is expensive. Not all of it is reimbursed. Like I started off saying, reimbursements are a big challenge. We in our nonprofit find out that we have to struggle to get a few $100s of reimbursement back for our treatments. A lot of burden on documentation on the clinicians, evidence-based care. You have to kind of show your outcomes. It's not as easy as physical health care is, where the patient got better, you're able to submit that evidence. Just extremely hard in mental health. And then finally, the big challenge that we find is just poor adherence to treatment plans and medications, right? We see that our folks come in, and after a couple of sessions, they want to drop off. They don't want to continue treatment. One, either they think that they got better, maybe they didn't build a bond with their therapists. Maybe they don't think this is for them. Maybe they don't think this is the kind of thing that they expected when they came into the clinics. So what have you, right? So poor adherence to care, which means that we are still having this mental disorder problem just percolating. So, I mean, looking at all this, right, I'm sure every one of you here is coming up with all sorts of solutions. I mean, technology, AI, I mean, it can do wonders, right? And it can. So some of the promises of AI in mental health, something that we are trying right now at our organization. So personalized treatment plans, right? So, when a patient comes in and they meet a certain demographic, a 55-year-old male served in Iraq and Afghanistan, has severe PTSD, does not have a great relationship with their family. And they come in and we have 6 years or 7 years worth of data that we have built in with treatment plans that have worked for some of these folks. So can we have personalized treatment plans where AI is able to profile a person that's coming in with some of these parameters and then kind of take that forward, right? Absolutely. One of the other things that we see as promises in AI, when it's any sort of front desk or administrative burden that you can take off of the clinician's plate. Clinical documentation, I mentioned, big, huge burden right now for reimbursements, for getting any sort of billing done. Can AI help with that? Can documentation be automated to the extent that a human is still checking the data, but most of the burden, most of the documenting piece is taken off? Can the front desk be helped, or can the case managers be helped with some sort of AI where, based on what is needed by the patient profile, it's putting the patient in touch with those resources in the case management field, for example, employment or food resources, or help with their religious communities in their societies. So the AI can do so much with the data that we have already collected, but is it easy just to kind of have AI point at these problems and then go, right? We heard from several folks this morning. We heard from Nicola and Connor, some great points were made where the use case or the right use case is super important, which is something that we have seen here, and it's, again, not loading really well, but I think it's a classic case of, we have a lot of solutions, but have you identified the right problem, right? Are you familiar with the term solution looking for a problem? That's kind of where I think mental health care is. We have seen a lot of folks saying, well, AI is here, let's go and address access issues. Let's go and have a chat bot or a virtual therapist replace the therapist because we don't have too many clinicians. We have found that that's not something that would work, actually, because the human bond, and I kind of started with that, when a client comes in, when a patient comes in with all of that trauma, all of those embedded behavioral health issues, maybe they're having all sorts of family issues, when they come in, they want to build that bond with the human being. And once that bond is established, we start seeing change in patient outcomes. We start seeing improvements. So can a virtual therapist replace that human bond? We don't know yet, right? Someday maybe, but not today. Now, can the virtual therapist or the chatbot help the clinician with some of this workload? So for example, a patient comes in and they have their therapy session. Now the patient goes home, their next therapy session is next week. Between this week and next week, can a virtual chatbot or a virtual therapist reach out and say, hey, we just had a therapy. How did you think? Did you complete some of the assignments that were given? Did you get a chance to complete that questionnaire that was given to you? So when you come back next week and talk to me, we are prepared. So we saw the digital twin in the earlier presentation, so something like that. So we believe in the current use cases, at least with our organization, we are seeing is that we can augment our current staffing with whether it's clinicians, whether it's admin staff, whether it's front desk, with some of these AI tools, not yet take away the humans, which is, again, something that has been said a few times. Well, AI is here. Can we replace some human beings? Can we replace some roles? Can we replace some jobs? Some of those, the GIFs that you see over there, the what if, asking the right question in mental health so that we can have the right solution built has been always the challenge, right? We again heard that this morning. So what if there was a chatbot or a virtual therapist that could make those touch points in between sessions? Would that be helpful? And what if a therapist was able to recommend or in fact prescribe video games in between sessions so that the session becomes more engaging? What if there was a digital twin that could replace in between session touch points so that you get that continuity of care, so especially for severe acuity patients? NeuroTracker, another product that you can actually use AI or video gaming to kind of improve your focus, improve your mental capacity so that when you come to sessions, you're more focused in explaining your problem to your therapist. Data in general, I mean, we talked about data this morning. Another thing that we have found as we build our data sets here, we need a lot of data that is actually accurate, that is rich, and that is actually helping us improve patient outcomes. So we use an electronic health record. Everybody familiar with electronic health records that are used in healthcare, right? So we use a big name electronic health record. You would think that that would be, kind of the panacea. Great, we have all of the data. So it's so not the case. Even with the best EHRs, as the studies have shown, clinicians are still struggling with documentation, and data scientists and tech folks are still struggling with getting data out of the EHR. Why is that? Most of these applications are not super interoperable. They were built with a very proprietary sense. They were built as a source of medical record. They were not meant for all of these use cases, right? Whether it's for intelligent scheduling, whether it's for AI-based clinical documentation. So any tools that you have in the market today they don't integrate well with these EHR products, right? One of the biggest problems that we have seen is that because there is no good integration with the tools that are available. I mean, we have so many vendors out there today. I'm sure there are APIs. I'm sure there are Fire apps that we can look at. But it's never an easy thing to just say, OK, let me take this tool, an automated clinical documentation tool, or an automated scheduling tool based on patient profile, and just plug this into the EHR. It just won't work. So what that leads to is that now you have the EHR working in its own little space, and then you have these other solutions that are working in their own little spaces, right? So if the end goal is to make our clinicians efficient, is that really a good solution to implement? Not really. So again, coming back to the solution looking for a problem, are we able to address the right problem in the right context? So some of the challenges to consider, I wanted to spend a little bit of time on this slide. Again, no one here is, I mean, I think every one of you has these exact same concerns. In mental health, even more so. So I wanted to kind of start with that. We talked about the therapist bond. It's just very unique in mental health, not so unique in some of the other healthcare practices, right? Not unique in other industries either. It's just very unique to the mental health industry, where the patient-therapist bond is of utmost importance. We have user adoption. I mean, some of that was covered in the sessions this morning. So to give an example, we, for the last 2 years, we have been extracting data out of our EHR, okay, and creating fabulous dashboards for our clinicians to use. And what are they able to do with these dashboards? They're able to see their no-show rates. They're able to see the clinician that always cancels their appointments at the last minute. They are able to see the patients that keep on coming, even though their patient outcomes are improving. They keep telling the therapist that they're not feeling better. So those are really very key data points that we want our clinicians to know, whether it's length of treatment, no-show rates, frequent no-shows. So we have been doing a lot of these dashboard development, getting a lot of data, giving some, having alerts for our clinicians when they see these problem patients. What we have found is, while the clinicians are thrilled to have all of these tools, there is not a lot of immediate adoption for these tools. One, they don't understand the data sometimes. The data has to be explained to them several times. The definitions have to be explained several times. They don't have time because they're busy with clinical care. So, what is the next step to that, right? What is the next step if dashboards are time-consuming? What is the next thing that could work? So virtual assistants, we talked a little bit about that in the earlier session. So is virtual assistants the way to go, where I'm able to simply query my data set and ask who is the patient, or give me my no-shows for the week? And the system kind of gives me those, and I know to go and tackle them, make phone calls, do interventions, whatever that may be. Possibly, yes. Would that make a difference? We don't know yet, right? These are all things that we are going to have to try. Again, because it's mental health and health care in general, whether it's informed consent, any sort of liability and disclosure is big. HIPAA is big at state federal law. HIPAA is the floor, as we know. The state privacy laws are even more stringent in most cases. And more so when it comes to mental health care, right? So are patients okay? And are we seeking consents from patients saying, I'm okay with this AI-based therapy, right? At the end of the day, if the AI is going to predict a treatment plan based on your profile, it's a black box at the end of the day, correct? So are we letting our patients know that we are using the AI aids to help them in their therapeutic care? It's something that we should have, something on file. Same thing with, as far as liability and disclosures. I mean, if there is an issue, let's say a treatment plan was, in fact, prescribed by AI, and the clinician kind of just, rubber stamped it, didn't really pay a lot of attention to it, and maybe that did not work. Is there a liability issue, right? And, who is liable in that case? Is it the AI? Is it the builder of the AI? Is it the clinician? How does it all work? So a lot of things to figure out over there. And then, so talking about cybersecurity, data privacy, confidentiality, all in together, we talked about large and very rich data sets needed for this type of, any sort of use cases that I just described, whether it's treatment plans, whether it's scheduling, whether it's, any sort of interventions. So how are we protecting this data? Where is the information governance? Does data privacy and the need for this large and voluminous intelligent data set cancel each other out? So in other words, are we compromising privacy and confidentiality of information just to make our AI more intelligent, right? Something to think about. And I think it's a very valid question in other industries as well, but again, more so in healthcare, more so in mental health. Some of the others, data quality. I talked about our EHR. It's what you enter is what you get out, so garbage in, garbage out. We see a lot of times our end users, our clinicians, our front desk folks make mistakes. So that is the data that is coming out, right? Right now, we have humans vetting out the data, making changes, making corrections. So when it goes into this, a black box or an AI tool, are we going to be sure that data quality is ensured, right? It is still going to be AI then learning off of bad data sets, bad data that's entered into the data set. So things for us to consider. Some of the others, technology disruption. I mean, it's always the playing the chase game. AI is here right now. It appears to be the big game changer. This ChatGPT exploded, and everyone wants to try something, do something with AI. But before you know it, that's going to be in the past, and something else is going to come in, right? Quantum computing. Everybody's talking about that. That's going to replace AI. So what about that? So there's always going to be the next thing that comes in. So how are we keeping up? And again, more so with this type of population, a very vulnerable population, and a very burdened clinician population. How are we going to make sure that we are not creating technology fatigue? We have heard this from our folks. Sometimes, our clinicians tell us, well, you have given us the EHR, you have given us this, you have given us Zoom, you have given us so many tools. It's too much. It's, we just need to focus on clinical care. So when does technology fatigue actually become a hindrance, that they can't perform their clinical care, which is the main thing. And then in general, competition or, the AI, AI, the ethical bias that exists within AI. I think, again, this is a very real problem. All of you know about it. In mental health, does that become a problem where wrong diagnoses or treatment plans are being provided, wrong types of patients are being marked as high risk, and the wrong types of patients are being marked as, oh no, this is anxiety, low risk, let them be in this bucket over here. Is there a bias that the AI is going to form based on data sets that we have built, right? I mean, again, the data was not built to inform a rich tool like AI. The data has been what it has been for years. It's legacy data. A lot of times we have two EHRs, a legacy and a current EHR. So what is the sort of data that we are feeding this AI tool, this AI engine? Do we know? Is that right amount of data? Do we need to do data cleansing before AI starts taking action on this data? So just a lot of considerations. It's not something that we are considering as, let's stop everything because these are too many problems. There are ways forward, right? And so, some of the things I've listed here, well, we are actively working with our EHR, all healthcare covered entities, mental health care practices, community behavioral health centers. I just recommend that build that real great bond with your EHR vendor if you have one. It's their cooperation in getting data to you, getting tools to you, having data sets opened up to you is going to be crucial in getting some of these projects off the ground. So collaborating with other mental health care providers, with your own clinicians to kind of even find out what the problem is, right? I talked about solution looking for a problem. We think that scheduling may be a problem for the front desk. We think that maybe customized treatment plans may be a solution for the clinician. But does the clinician think so, right? What is the clinician's problem? Maybe the clinician's problem is, I just need more hours in the day to complete my documentation. So that may be the problem that we need to attack first. So just some conversations. There was an excellent slide in one of the earlier presentations this morning that talked about how the business users or the domain experts need to play a crucial role. Like without them, IT cannot drive a lot of these projects forward. IT can tease them. IT can, provide, knowledge and say what's in the industry, but IT cannot be the driver of these projects. It needs to be the domain experts who come and say, well, this is a less important problem than this other one, which needs to be tackled first. And then, encouraging interdisciplinary research, right? I mean, so much work can be done to kind of look for other issues or other ways that can improve clinical care, whether it's looking at the outcomes. So as an example, when you look at PTSD or the post-traumatic stress disorder, most of our veterans come home with that. There is a scale of scores that they get when they complete their questionnaires during their therapy sessions, right? Those questions are, extremely deep. It goes deep into asking them questions about their relationships, about how they're getting better from week to week, about whether they feel angry all the time, about whether they feel like harming themselves or whether they feel like harming others. So those are very specific questions that are asked during those therapy sessions. So can those be improved to inform, again, the treatment plan? Can those be improved to perhaps an AI tool can use some of a different type of format of these questionnaires to to get better answers and, again, improve patient outcomes. So a lot of promise there. Research is very new. I mean, there's so much research opportunity in the field of mental health and technology and AI that it's a lot of exciting work. That's all I'm going to say. And then contribute towards meaningful legislation, regulatory standards, right? I mean, it's something that needs to be on top of mind for anybody in healthcare. Some of these, state regulations, when they come down as drafts, it is upon the covered entities and some of the compliance and legal folks to kind of read them and push back a little bit on the state, have a lobby group formed and kind of say that sometimes some of these things don't make sense, or maybe sometimes you're not putting enough regulation where it's needed. Everybody's talking about regulating AI right now. How does that work with mental health data? Is mental health regulation, data regulation different than, another industry perhaps? The answer is probably yes. So how do we do that so it's a good balance between how we want to move things forward, how we want to make our patient outcomes better, but at the same time also, following the law. And then regular evaluation validation. I mean, just quickly, subject matter experts have to be regularly consulted, see if the data model is making sense, always keep checking the data for efficacy and bias issues, and keep improving the data quality. I've been given the thing, I know I'm almost time, but in summary, AI has immense potential to transform just, mental health care in general, and not just, the clinical side, right? All of it, the operational side as well, whether it's access, whether it's scheduling, whether it's case management, whether it's having the continuity of care once the therapy session is done. So just, amazing things to come. But thank you very much for your time. Appreciate it.